join us. So thank you all for coming out today. Last year I carried a similar bill, and now with the with the Federal Healthcare Affordable Healthcare Act, we feel that this bill is a better bill because it aligns the out-of-pocket caps with the amounts that are in the Affordable Healthcare Act. My bill, AB 1800, creates certainty and peace of mind for those who have a chronic serious illness, and even those who may face an unexpected illness or debilitating major catastrophe or accident. So this is really healthcare justice for all. It would require a single patient, or it would cap a single patient, their maximum out-of-pocket cost to $5,950, and a family of any size would pay $11,900. And again, this is also the same amount that's in the U.S. Federal Affordable Healthcare Act. A study commissioned by the Families USA reports that more than 1.9 million Californians spent more than these limits in 2011 alone. The cost exceeded more than $3 billion in out-of-pocket expenses. And here at the charts right next to me, these are actual costs that Mary Ann Braubach incurred. Under the current law, she paid, just in January through March, the first quarter, she paid $8,519. And under our law, AB 1800, she would pay the maximum of $5,950. And that's only one quarter. We haven't even hit the other 3 quarters of the year. So AB 1800 would cover the more expensive specialty tier prescriptions for patients with chronic conditions like cancer, multiple sclerosis, and HIV. And without AB 1800, the Federal Health Care Act, which covers out-of-pocket expenses, will not help patients until 2014. So this bill is necessary to help patients have certainty and peace of mind for 2013. If it passes and gets signed by the governor, which we feel is very important for many here on the stage, and even the many people who are not here today. So without further ado, I'm going to have 4 speakers here today. Mary Ann Braubach, she's a documentary filmmaker who was also a production executive at Lucasfilm and worked with production companies at Disney, Warner Brothers, and Universal. She co-produced the Oscar-nominated Brazilian film 4 Days in September, and she volunteers and fundraises for nonprofits working to bring social, economic, and environmental justice to her home city of Los Angeles. She's an exceptional MS advocate and has been living with MS for 14 years. Mary Ann.
On a summer Sunday in 2003, I was swimming with my 8-year-old son. Monday morning, I woke up paralyzed from the waist down. That MS relapse began a 1.5 years of life in and out of a wheelchair, and hospitalizations and treatments costing hundreds of thousands of dollars. My story really begins 14 years earlier in 1998. Numbness, tingling, extreme pain, optic neuritis. I spent 3 years of my life, tens of thousands of dollars, for procedures, diagnostic tests, and visits to specialists to finally be diagnosed with, in 2001, with lupus, Sjogren's syndrome, and remitting, relapsing multiple sclerosis. The neurologist first prescribed Copaxone. Copaxone is an FDA-approved treatment for MS, a daily injectable. The drug costs about $40,000 a year, and there are no generics. In 2003, my doctors alternated from Copaxone to Revit, another MS-approved drug, which costs also about $40,000 a year. But despite these treatments, I had that relapse and subsequent hospitalization in that summer of 2003. Those months of hospitalization, rehab, massive doses of steroids, the chemotherapy, Cytoxan, plasmapheresis treatments were well over $100,000. Within a year, in March of 2004, I had a second relapse, and my most serious. This time, the doctors told me I would never walk again. I could not even wiggle a toe. I was stuck in the hospital in a wheelchair and separated from my husband and son. My doctors wanted to try something else, and they wanted me to try Rituxan, which is a chemotherapy which was developed for lymphoma B. I had relapses and paralysis on the MS-approved drugs, and they were searching for a new treatment. They designed a treatment plan. In addition to the daily injections of Copaxone, they added infusions of Rituxan 4 times a year at an oncology clinic. And trials of Rituxan were just beginning in 2004, but I did not qualify for those. And Rituxan costs about $80,000 a year. And in May of 2004, the rehab physicians sent me home in a wheelchair. There was really nothing more they could do for me. I did physical therapy at home, and after 3 months of Copaxone and the Rituxan infusions, I was out of the wheelchair and using a walker. But in July of 2004, I lost my balance, I fell, and I broke my hip. I had developed osteoporosis from the 6 years of steroids. And the surgery and months of hospital rehab for the hips surgery cost, well over $100,000. But eventually, I was able to walk and use crutches. And I continued to improve, and my doctors credit my amazing recovery to the Rituxan and Copaxone cocktail. I also practice Iyengar yoga, and I swim, and I exercise. But my drug costs are exorbitant. This year, and it is only March, I've spent almost $3,000 on co-pays just for Copaxone. These costs are high, but they are far cheaper than my past hospitalizations. And month to month, I don't know the price of my co-pays. I must refill the Copaxone every month, or the insurance company might deny me the coverage later on. So every month when I call the pharmacy to refill the prescription, I'm told the copay amount. The same drug I've been taking since 2001 has skyrocketed. In January, the copay was $900. In February, it was $1,100. In March, it was almost $1,200. I couldn't believe it, so I demanded to speak to a supervisor. And finally, after 30 minutes of waiting, I found someone who was slightly sympathetic, and they reduced it by almost $500. I don't know why, but they did. But I have no way of knowing what the copay will be in April. And the Rituxan is not FDA approved for MS, so it is not covered. And the pharmaceutical company had approved me for an assistance program, and the $80,000 cost for the 4 infusions a year was reduced to the clinical charges, which amount to about $2,000 that I paid to the oncology clinic. But I personally cannot afford that. And in January, the insurance company, the pharmaceutical company, denied me any assistance. So this drug I've been taking for 8 years, they got me out of a wheelchair and walking, prevented relapses and more costly hospital stays, is now unaffordable. It's allowed me to be an active member of society, to work, to make films, and to live at home with my husband and son. And I'm fortunate to have a family income that's slightly above the allowable amount for the Pharmaceuticals Assistance Program, yet I'm unable to afford the drug. And besides MS medications, I have other medical expenses, doctor's visits, MRIs, infusions for the osteoporosis, and these all cost money. And my doctors have prescribed physical therapy 2 times a week for me to improve my balance and strength. But the insurance company only covers 1 visit a month. And recently I lost my balance, I fell, hurt my knee, and I just had knee surgery. That cost over $5,000. My son graduates high school in June and starts college in the fall. We have his tuition to pay. We've been using our savings to pay for these medical costs and maintain our health and my health. And I'm grateful for these treatments. They've allowed me to lead a productive life and to be able to fight for this bill that will hopefully help people not have to use their livelihoods to pay for exorbitant medical bills. It's So anyway, thank you very much.
Thank you. The next speaker is Dr. John Schaefer. He's currently the director of the Mercy MS Center in Sacramento, as well as a staff member of the Mercy Neurologic Institute. Dr. Schaefer is also a member of the board of directors of the Northern California chapter of the National Multiple Sclerosis Society. He has received numerous honors from both the American Heart Association and the National MS Society.
Thank you. I am a neurologist. I take care of lots of people with multiple sclerosis and other neurologic disorders. And what I want to tell you is that what you've just heard is not a unique situation. It's very common. For many medical conditions, including cancers and organ transplantation and multiple sclerosis and other autoimmune disorders, we're seeing an increasing number of medications that not only relieve symptoms, but for the very first time can slow or prevent progression and greatly decrease the chances of people with MS, for example, of becoming unable to work or even unable to care for themselves. And what we've learned about these medications is that to get the greatest benefit, they need to be started early on, before disability has occurred. They're also long-term medications that people will take for many years. The reality is that, as you've heard, many of these new medications are extremely expensive. And insurance companies have relegated some of these, or most of these, to the very highest tier of payment, so that patients are required to make out-of-pocket payments, just as you heard here, of hundreds of dollars a month, even thousands of dollars a month, or tens of thousands of dollars a year. So to me, it's greatly distressing when I see patients that are that would definitely benefit from these medications, but they can't take them because their insurance doesn't cover them, even when they thought that they had an insurance plan that did cover them. So I think that AB 1800 is critical and is badly needed to enable individuals to get the greatest benefit from these wonderful new developments that are coming along in the way of our ability to treat these disorders. Thank you.
Thank you. Our next speaker is Anthony Wright, Executive Director of Health Access California, the statewide Healthcare Consumer Advocacy Coalition and the co-sponsor of AB 1800. Very excited to continue working with Anthony and Health Access to make sure we do all we can to get this bill signed.
Thank you, Assemblywoman Ma. Again, my name is Anthony Wright, Executive Director of Health Access California, the statewide Healthcare Consumer Advocacy Coalition. This is an important week. This week, this Friday, is the second anniversary of the Affordable Care Act. And California has been in the lead in implementing the Affordable Care Act and bringing those benefits to Californians. And this is another step in making health reform real for Californians. Because this is not just about MS. This bill, 1800, is not just about MS, and it's not just about the cost of prescription drugs. It's about protecting consumers with serious illnesses like cancer or heart attack, or chronic conditions like diabetes or heart disease. It's about the out-of-pocket costs that consumers pay for co-pays and deductibles for doctors, hospitals, lab tests, chemotherapy, and yes, prescription drugs too. The AB 1800 caps those costs for covered benefits. This is about implementing the Affordable Care Act and a very important part of it, which is trying to provide security and peace of mind to people who have coverage already. It's about getting rid of the fear of the fine print that so many consumers have, that their coverage is not going to be there for them when they need it. That they're going to face, even though they've been paying premiums, that they will fall through a loophole where the prescription that they want is not covered or has such a high copay that they still have medical debt, they still face collections and bankruptcy. So this is about providing confidence in coverage so that it's there when we need it. For example, it tries to get rid of the fine print about having different deductibles. When you and I shop for plans, we think, okay, what is the deductible going to be? we don't think that there might be one deductible for doctor visits and another deductible for prescription drugs. And yet that's a trap that many consumers fall through. AB 1800 corrects that problem. It also corrects an injustice that denies consumers the right to appeal the denial of a drug using independent medical review, updating the landmark HMO Patients' Bill of Rights that exists in California. So this is a step forward for not just for MS patients or for people with chronic conditions. This is a step forward for consumer rights in general. It's also a step forward in getting to the promised goal of having security in our coverage. That is what the Affordable Care Act is all about. Thank you very much.
Thank you, and our final speaker is Irma Resendez, who founded Familia Unida, Families United Living with MS, which proudly stands as the first bilingual English-Spanish multiple sclerosis nonprofit organization in the U.S. history. Under her leadership, Familia Unida provides critical and culturally sensitive services at no cost throughout the Southern California region and is contacted from all parts of the world. Ms. Resendez has received multiple honors such as Woman of the Year for the state of California and KABC 7-CVS Pharmacy's Women of Courage. She's been recognized by La Opinion as one of the top 80 future leaders.
Thank you, Assemblywoman. I'm so happy to be here in Sacramento representing Familia Unida Living with Multiple Sclerosis, but also in collaboration with the National MS Society. Today is an important day for all of us. And the reason why I say this, and I've come from East LA today and made this a priority for us, is we're seeing more of our families who are having to struggle with paying a co-payment of $200, sometimes $2,000 a month. And what does this mean to our families? They come to our office with a desperate look in their face, with sadness, confusion, and they come to us for answers that we don't have. The answers are, how do I pay for my daughter's food? How do I pay for my rent? Or do I pay for this medication that is costing me $200, maybe not a lot of money for some, but for the low-income families that we serve, $200 is a lot of money. Now we learned just last week, another one of our members, Daniel, he has to pay over $2,000 a month for his MS medication. He feels like a failure. His parents feel like failures. Why? Because they cannot afford it either. Our young adults are being forced to move back home so that they can help cover these bills. This is an injustice. This is unethical. And why, again and again, the low income, the Latino families that we serve, over 15,000 families that we serve, are facing this horrible, unethical, unconstitutional thing. It is very upsetting to me. I was diagnosed in the early 90s. I was told I would never walk again. My girls were 3 and 4. And when this happened to me, I was feeling very much alone. There was no information available or accessible in Spanish. I'm happy to say that we've evolved to serve many cultures, many people, and today we're here as one to represent many that are isolated and that feel very much alone. I thank the media that is here today, and I pray that you will find some space in your newspaper to ask these questions, to ask how many people in your community are paying this out-of-pocket expense. Ask that question, please. And I hope that your newspaper will be filtered with calls and responses so that you can feel the heart and the desperation that I feel every week. I thank you very much.
Thank you very much. So I have been a poster child for the Hepatitis B campaign. Hepatitis B directly affects a person's liver. However, here in California, Medi-Cal will only cover a patient if they have liver cancer will require a liver transplant, way too late in the process. And there are many people that require medication and professional services that just can't afford it. And we've heard here today that time is of the essence, that there is healthcare injustice, that we should not force people to choose between buying a medication or providing food for their family or even being able to live a quality life. So I thank you for your attendance here today. AB 1800, we're going to work really hard to pass it this year. So if you have any questions, we're open.
AB 1800, it's going to cap the cost. Could you explain who's going to be making up the difference?
Well, Beth, perhaps I'm going to call my lifeline. Okay.
This will be something that will be required by to be a standard in insurance companies. So it would be the insurance companies who do this as part of the as part of their basic benefit. It sets a standard for what coverage should cover, so that so the insurers will say that it may be then baked into the premium, but we think that that's a small price to pay for the fact that you actually have confidence that your coverage is actually going to cover you when you have a situation like MS or another condition.
So there wouldn't be an extra cost to the state. This would all be offset through the insurance companies.
Private insurance.
Yes.
Anthony, as you know, there's at least some level of political and legal doubt about the future of the Affordable Health Care Act.
I hadn't heard.
So this would make, the law of the state of California, regardless of the ultimate outcome of the Affordable Health Care, correct?
Yes.
Okay.
And the other thing it does is that it does it earlier. So it puts it in place in 2013 rather than 2014, which is what the federal law does, and it applies to grandfathered plans, which are the plans that have been exempted from those requirements. It would apply to them so that all Californians have this benefit.
And it would cover all health plans that manage care that are regulated by all the various entities.
By both the Department of Health Care and by the Department of Insurance
care plans.
And are unique to regulatory systems.
Any health plan issued in the state of California.
That's correct.
And the second part is it also gives a if people have a dispute, they now can go before the independent medical review board. Whereas now, if a patient has a dispute with their insurance company, their doctor wants to prescribe a drug and the insurance company denies it, they're pretty much stuck. They can't go anywhere else to ask for another second opinion.
But as to your question about the debt, I don't believe that the point of this is to do something because we think that the ACA is in doubt. I feel particularly very confident about what will happen in the Supreme Court next week, oral arguments, Monday through Wednesday of next week. But we do think that these are important consumer protections regardless. And we want to make sure that we bring those benefits to Californians as soon as possible.
Any other questions? Okay. Well, thank you very much, and we'll be here for a little bit. Thank you. Thank you.